Okay, good morning everyone.
Good morning, ma'am.
So little bit I just want to revise regarding this with specific reference to silent nursing. Okay, nursing process means the nursing care plan, no? Yes?
Yes, ma'am.
Nursing care plan you are
Yes,
writing in the
ma'am.
word that you are learning from first year itself, right? But I feel like somewhere you are still confused with. So basically, in connection with child health nursing, little bit we'll talk about. Okay, we'll just discuss only. Try to contribute because you have learned these things in first year also, second year also, third year also. Now you are going to learn. Okay. So what it is actually nursing process is what? What is coming to your mind? What it is? What do you do when we ask you to write nursing care plan?
Ma'am. Assessment.
Yes, you do assessment and then
Assessing, then plan diagnosis, goal,
yes, then
planning, implementation,
yes,
evaluation.
yes. And then after evaluation, what is there? After evaluation, also something is there. Can someone tell?
Ma'am, documentation.
After that, after that also something is there. Mm-hmm. After evaluation, documentation, like see, for example, one child. I'm giving the examples only from the child health nursing because I'm going to tell about the about specifically in relation to child. Okay, so a child is having high body temperature. You have assessed the child. You have given physical therapies. All the measures you have taken. You have seen that it is not coming down to normal. Okay, on evaluation after implementing you have seen that it is not coming down. Okay, that evaluation is saying that it is not coming down, it is coming down but it is not reaching near normal, maybe. So in that case what you need to do, you have to replan. Okay, after evaluation there is another phase, that is replanning. Okay, clear? So what basically it is, the nursing process, it is a problem solving approach towards management of a patient, be it elderly patient or a adult patient or a child. Okay, problem solving. So if you see the definition, you not to write all these things. This is just a review class. Okay, nursing process is a systematic problem solving approach used to identify, prevent, and treat actual and potential health problems, as well as promote wellness for individual groups and communities. This definition you have learned many times, right?
Yes, ma'am.
Okay. So is there any problem in understanding this? What is nursing process is? Actual and potential, are you able to differentiate? And why the last part is there? As well as to promote wellness for an individual or group or community. Why groups and communities this is coming? Because you are going to community also. In that case you do community diagnosis. Yes or no? Here in connection with an individual, be it a child or an adult patient. Okay, even though I am telling about with reference to child nursing, but the basic things are same. Like the nursing diagnosis, these are little bit different, but almost many nursing diagnoses are same with them. Like you do for medical surgical nursing, it is the same nursing diagnosis you have to make, and some more are there in addition to that, but basically the basic thing is same, the nursing process. Okay, now the actual and potential health problem plus your wellness. Okay, three things are here. I think in the next slides you will be a bit clear about actual and potential problem. In your exam also I am asking you to write one actual problem nursing diagnosis you do, and then one potential nursing diagnosis you prepare. Did I tell you like that? Do you remember?
Yes,
Yes,
ma'am.
ma'am. So I could find that some of you are not able to differentiate what is actual problem and what is potential problem. Okay, we will see. Now we will see after this. So basic steps, these are the assessment, nursing diagnosis, planning, implementation, and evaluation. These are the basic 5 steps of nursing process. Okay. While writing the nursing care plan, we also write the goal, and also for each and every planning we write the rationale also. So this you are doing. Okay. And some of you are even making mistake in writing this also. Please be careful a bit. Assessment, nursing diagnosis, goal, planning, rationale, after that implementation and evaluation. Sometimes I see that implementation is coming even before the planning. These kind of things also I'm seeing in nursing care plans. So be a bit careful, okay? What you do. This is the sequence. Now, what is assessment? Briefly about you are doing also, you know also. Assessment is deliberate and systematic collection of data to determine client's current and past health stress. What do you do? Right now, for example, one of you are saying that you do assessment, you do planning, you make nursing diagnosis, you do planning, and then you implement, and then later on you evaluate, right? So how do you do assessment? You just simply collect data, right? From the patients as well as here, not only from the child, you also take history from the parents. Basically you take from the parents, you take the history, the person who is accompanying the child, as well as if possible from the child also you are taking the history, right? You are doing that or not? Yes.
Yes, ma'am.
Yes, you are doing that. So you are collecting history, it is past history also, present history also you are collecting. You are doing initial assessments. Like when you are meeting the patient for the first time, you are doing the assessments. So the types of assessments are initial assessment, problem focused, emergency, time lapse reassessment. Okay, like initial assessment, on meeting the for the first time, whatever assessment you do, wherever you meet the child, you do the initial assessment. When patient is there in the clinical, suppose you are meeting the patient, there is a you are attending that child, you are taking care of that child, you are being assigned that child, and then some problems are there, you do again assessment, right? That is problem focused assessment. The child will report that I am having this problem, so you do assessment. So that is problem focused assessment. Emergency assessment, like any kind of emergency is there, that time also you do some kind of assessment again. Time lapse assessment, suppose the patient is diagnosed as having anemia, and for long time patient has not done any review, and on coming to hospital you are again doing the assessment. That is time lapse reassessment. So kind of assessment is not much important, but then how you are doing the assessment, you do what kind of methods you apply for assessment. You do interviewing the parents as well as the child if possible, like for data collection or the history collection, right? For history collection you do from the parents as well as from the child, if the child can tell you, if the child is old child. So physical assessment, you do head to toe examination, you do it or not? Yes? Do you do? Yes, you are doing that.
Yes, ma'am.
So you correlate with the laboratory findings also, what the findings are saying. Observation of behavior, I think in the in your second year, I was telling you in CET, I think I have taken no classes for you. CET. So how you should observe the cues from the patients? Yes or no? Do you remember? Observation of behaviors. You are going to talk to the child, and then child is not welcoming you, the turning the face away from you. That means that cue you should understand as the child is not ready to talk now. Okay? So behavior, observation of behavior, what kind of behavior the child is presenting, or what kind of behavior the parents who are attending the child are presenting, because in child health you have to attend to the child as well as the parents also. It is a family centered approach. Do you remember? Do you remember something? It is family centered approach. Could you remember something? Could you remember something? What was the family centered approach? Anyone? At the beginning, those concepts I was telling about, family centered approach. If no, tell me no.
No, ma'am.
Why?
No, ma'am.
Why?
No, ma'am.
A traumatic care, family
No,
centered
ma'am.
care. If you say no, what will I do? But I have taken these classes. No one remember. A traumatic care, family centered care. Do you remember now? We have to treat the child as well as the family also. Family means how you have to treat the family, how the parents are taking care or the caretaker is taking care of the child. Is the parents or the caretaker is able to take care or not able to take care? You have to make them learn how to take care. Okay? You remember now something? Something you remember or not?
Yes, ma'am.
Now you remember.
Yes,
Traumatic
ma'am.
care, family centered care, primary nursing. These things I talked to you, right? In the beginning. I talked to you, please review this thing. In child health nursing, the concept is a bit different. Okay, not everything is similar with medical surgical nursing. Okay, observation of behavior, growth and development assessment. You do growth and development assessment of the child, review of literature. Some of the findings you get, sometimes you get confused whether this is a presentation of this kind of problem or not. Sometimes you do literature review also, and then you get confirmed while doing the assessment. Consultation with physician also, something you find and then you consult with them whether these kind of problems are there with this type of problem or not. So these are the kinds of assessment, the methods of assessment you do. Okay. Now coming back to nursing diagnosis. Okay. Nursing diagnosis. What is nursing diagnosis? It is the problem. Like the doctor's diagnosis, the medical diagnosis is there, like or peptic ulcer, like maybe some other problem, gastroesophageal reflux disease, or any kind of malnutrition. These are the diagnoses made by the doctors. Okay. Similarly, we also prepare some diagnosis, and we have the cause also. We have to find out what is causing that problem. If you define nursing diagnosis, if what is it, what is the problem? Okay, what is the problem? So a clinical judgment about individual, family or community responses to acute or potential health problems. Okay, whatever the problem is there, we give a terminology, we give a term to that problem. Okay, clinical judgment or the problem. Okay, that is nursing diagnosis. And it consists of two sections joined by a phrase related to, do you remember this? You write no? Like impaired physical mobility related to this. Do you remember? You write nursing diagnosis like this, no? Yes or no? Imbalance,
Yes,
nutrition,
ma'am.
yes?
Yes,
Yes.
ma'am.
So related to, you join this section by a phrase related to. So I have given a list. In that list, I have not counted. Of course, I do not know how many nursing diagnoses were there. As of in the year 2020, there were 244 nursing diagnoses that has been approved. Okay, so it is updated in the year 2020 also. I think the list I have given on top of that also another list is there. Okay, that is approved. Okay, why do we have to prepare the nursing diagnosis? Little bit about this. Okay, why you have to prepare? Because you have to find the problem, then only you can prioritize which is the problem you have to attend to first, and then you have to attend second or last. Then you have to plan the implementation. What are the planning you will be doing to attend to that particular problem? Okay. Now, uh, this will help you to identify the nursing priorities. Like sometimes the child is on pain, having severe pain, and whereas you are thinking of maintaining the activities of daily living, that is not a priority implementation. Okay, you have to attend to the pain first, and then you have to go to the next things next after that. So it helps you to prioritizing the nursing planning implementation, helps in directing nursing intervention based on identified priorities, helps in formulation of expected outcome. What do you expect after implementation of this, the nursing diagnosis? Once you make, this will help you, this will give a direction to move out, to towards solving a problem. Provides a basis of evaluation to determine if the nursing care was beneficial to the client or not. And for you people, nursing diagnosis are an effective teaching tool to help sharpen your problem solving and critical thinking skills. Like once you are after assessment, once you are able to identify the formulate the nursing diagnosis, you will know what all things to be doing, and then you will be doing and how to solve that problem of the child. Okay, so that helps you to develop your critical thinking skills. It helps you to think scientifically and logically. Okay, think scientifically and not logically, not just superficially doing this, that, like that. Okay, so we are seeing the components of nursing diagnosis now. Okay, we have diagnostic level, we have related factors, we have defining characteristics. This is the problem, the diagnostic level, this is the problem we diagnose. Okay, this is the nursing diagnosis we make. The related factor, this is the etiology. Okay, this is the cause. Related to what? Impaired physical mobility related to maybe neuromuscular injury, maybe pain. So this became the cause, na? Yes or no? The related factor, you write, that becomes the cause. Could you follow me? Could you
Yes,
follow me?
ma'am. Yes, ma'am.
So the related factor is becoming it is the cause. And defining characteristics, these are the sign and symptoms. Okay, for example, yes, we'll see in the next slide, diagnostic level. The name of the diagnosis is, for example, this is the impaired physical mobility. Okay, so related factors are the condition that causative factors resulting the problem. It may be the impaired physical mobility might be due to pain, maybe due to discomfort, maybe neuromuscular, some impairments, maybe due to some injuries. Okay, so this is becoming the cause, right? The related factor is becoming the cause, and this is becoming the problem. Okay, this is the diagnosis, and these are the etiology. Next slide, you will see the sign and symptoms indicating the problem. This is the defining characteristics. Okay, the sign and symptoms indicating the problem. What sign and symptom is saying that this problem is there. So because of impaired physical mobility, the child is not able to go to toilet, not able to have food by himself or herself. So these are the activities of daily living, right? You are understanding
Yes,
or
ma'am.
not? If you are not able to understand, you are not able to follow, please tell. Anyone till here able to follow or not? Yes? So in actual diagnosis has all these three parts, but potential nursing diagnosis does not include defining characteristics. What are the defining characteristics? These are the sign and symptoms. For example, here you have seen, I have given that example, that impaired physical mobility related to maybe neuromuscular injury, and the defining characteristics are that the child is not able to go to toilet, child is not able to brush his teeth, not able to have food by himself or herself. Okay, so this is the sign and symptoms you are observing in the patient. Now, what will be the potential nursing diagnosis with this? What is the risk factor associated with this? Because of impaired physical mobility, the child is not able to come out from the bed. So there is risk for what? Impaired skin?
Skin integrity.
Yes, very good. Impaired skin integrity. That is a risk the child might develop because child is confined to the bed. So child is not coming out. That means there is a risk the child might develop a pressure sores. So that is a potential nursing diagnosis or the risk diagnosis. Could you follow me now? We are not having,
Yes, ma'am.
we are not observing that skin is impaired already, but then that means we are not seeing the sign and symptoms, the defining characteristics we are not having, but then there is a risk. That is why I am saying here that actual diagnosis has all these three parts, But potential nursing diagnosis does not include the defining characteristics. That means this will not produce the, in actual nursing diagnosis, you will not be seeing the defining characteristics. That means you will not see the sign and symptoms. Because of that problem, the child is having the risk to develop this. So that is potential nursing diagnosis. And that is written as risk for this, like that. Okay, clear now? Yes, no?
Yes, ma'am.
Now you see this. This I think you should better copy. I know you all will be keeping the screenshots. Till this time, how many screenshots you are keeping? Tell me, honestly. Tell. Keeping, na? Yes or no? Everyone is keeping?
Yes, ma'am.
Yeah, very good, very good. This one you keep, this one you don't fail to keep, okay? This one you keep. Now we have three kinds of nursing diagnosis. I am already telling you about actual and risk or potential nursing diagnosis, but then from where it is coming now? Another one. Wellness nursing diagnosis. One more is there. Okay? Have you heard about this? Anyone? Wellness nursing diagnosis? Yes, no? Yes. No. Are you sure? Are you sure? What have you read? I have given a list of nursing diagnoses. Do you have the list with you? Do you have the list with you?
Yes, ma'am.
Yes. Okay. So, what was the first section? Tell me. What was the first domain?
Health promotion.
Yes. After that, class 1 health awareness and class 2 is health management. Right? Under that, you see 1, 2, 3, 4, 5, 6. Number 7. Readiness for enhanced health management. Have you seen it? Readiness for enhanced health management. Have you all seen it?
Yes, ma'am.
Yes. Again, in the domain of nutrition, if you see readiness for enhanced breastfeeding, similarly, if you see the whole list, you will see there will be readiness for maybe coping, enhanced family coping, because the what happens usually, the once the child is born or the baby is born with some physical defects or maybe some chronic illnesses the child is having, the parents are not able to accept them, and then they do not know how to care, and they don't cannot cope with the problem. Once you make them understand what is the problem, how this child can be cared, what they can do, how they can do, all these things you can make them understand, they are able to, they are willing to take care of the child. That means they will ask you a lot of things. So enhanced family coping, readiness for enhanced family coping, that will be verbalized by they will be keeping on asking you the how to take care of the child or relating to the specific condition the child is presenting. Okay, so that is becoming your, that is the last part. In the beginning I told you, no, actual, potential and wellness was there. This is a wellness nursing diagnosis. Okay, for health promotion. Wellness nursing diagnosis, this is for health promotion. You see, here in the actual nursing diagnosis, you have the diagnostic level, that is the problem, the related factor, the etiology, the defining characteristics. These three things are, you are clear with that example I have given? Are you clear?
Yes,
Yes.
ma'am.
So here I told you that you will not see the sign and symptoms in the risk diagnosis or potential diagnosis, because we are only the child is potential having risk to develop this, not yet producing sign and symptoms, but then child is likely to have impaired skin integrity because the child is not able to move out of the bed, the child is having impaired physical mobility. Okay, not producing sign and symptoms. That is why the defining characteristics we are not having here. Okay, we are having the diagnostic level and only the related factor here. The risk for the child is having risk for developing these diseases related to what? Because there is physical immobility is there because of the pain, because of the injury. Injury is the cause. Okay, the diagnostic level you are preparing as risk for impaired skin integrity. Okay, so this will be your uh, risk diagnosis. In wellness diagnosis, you write with that word. You will see only the diagnostic level. You will only diagnose. You will have only the problem. There will be no etiology. You will not be writing the etiology also, no related factor also you will be writing. This you will write only evidence by what. Okay, evidence by what. So that is wellness nursing diagnosis. And then you write, you start with that word readiness. Okay, readiness for enhance this, that. Okay, could you see this? Clear? Okay, this is again the same thing, just to differentiate. What actual diagnosis it describes? It describes a human response to a health condition the child is having or the life processes affecting the child. Okay, whereas here it describes the responses to health condition or life processes that may develop in a vulnerable child. The child who is vulnerable to develop impaired skin integrity. That is an example I am giving. Okay. So this is supported by defining characteristics. Actual nursing diagnosis is supported by defining characteristics. That means these are the manifestations or the signs and symptoms or the related cues or inferences you can make. So it has got 3 parts. Whereas they are supported by risk factors. The risk factor is what? They are not able to move out. Because of that, the child is likely to develop impaired skin integrity. Okay, so there will be only risk factors. So does not include defining characteristics. These signs and symptoms you will not be having in the risk or potential diagnosis. That is why it will be having only 2 parts. This part will not be there. Only the related factors, that is in the form of risk factor, it will be there. The child who is vulnerable, and then this will be constituting only 2 parts. Okay. So wellness diagnosis or disease for the health promotion. This describes the human responses to a level of wellness in an individual, family or community that have a potential or for enhancement to a higher state. Whatever the level of wellness right now I am having potential to move to the higher level of wellness with some education or enabling them with some teaching with health education. There they can do this to move to the higher level of wellness. Whatever level of wellness they are having right now, they are likely to develop more well, have a level of wellness which is higher than that. Okay, so you start with this word readiness for enhanced family coping. For example, this is an example only. Enhance family coping, evidence by verbalization of desire to have information regarding the care of the child who is not able to grow properly or child is having malnutrition or any condition, impaired physical mobility, whatever. Okay, so this will be coming. This is the wellness nursing diagnosis. So this I think I need not to tell you so much. You are framing the goals. Okay, while writing the nursing care plan, we talk about assessment, we talk about nursing diagnosis. Next is your goal, right? Next is your goal.
Yes.
So a goal should be long term and short term. Okay, short term, suppose pain is there, you have to take short term goal. Suppose the delayed growth and development is there, you have to take long term goal. Okay, so short term, long term goal, I think this is enough explained to you earlier. It should be, goal should be client oriented, focus on single aspect. It is not that one goal you will be taking for two things. Okay, on single aspect you will be focusing on while writing the goal. It should be observable and measurable. You have to be able to evaluate. So planning, what does it mean? How to manage the problem? How to manage the problem? You will plan for that. So, setting the child-centered goal and expected outcome and planning nursing intervention. This is the planning. Nursing intervention should be nurse-initiated or maybe physician-initiated or collaborative. Sometimes they, how come it is physician-initiated? Suppose imbalance nutrition is there, the physician has advised, or the child is not able to swallow, physician has advised ratio feeding. So this is a physician initiator. Okay, those should be on the priority basis. This I have explained enough, I hope. And then rational. For each and every planning you do, you have to give the rationale for what you are doing that, what how it will help. That is the rationale. So implementation, or this is nursing intervention. That is the second last process. Whatever you do the planning, you implement it, you execute the plan. Okay, you make it possible, you do it. So in the intervention, what you do, you reassess. First line you write that these are the patient is assessed, these are the findings we could see. Okay, in the planning first in the intervention phase, first thing you write about this thing. Then you review the care plan. Whatever care you have planned, you have to review. Organize the resources for care delivery. Whatever resources are available. Sometimes you go hunt the things, go hunting the things from the other worlds also. You do, no? You do or not? So whatever resources are available, sometimes what happens, even though the things are available in the world, you do not think that this can be used like this, like that. So whatever resources are available, within that you should be planning, and then whatever resources are there, that you should be using. Okay. Anticipate and prevent complication. After this, what complication might be there? It is not that you wanted to do this, you are doing this, but then what complication might arise, that also you should be prepared. Implement the nursing intervention and then document the intervention. Finally, what you do, you write it. Okay, you do documentation. So last phase is evaluation. Did your plan work? Whatever plan you have made, did your plan work? That is evaluation. Okay, did your plan work? This is the most important steps in nursing process, where actual outcome is compared to the expected outcome. You are expecting that temperature should be coming down to this, but then it is coming down to only this. Okay, so that should be your evaluation. On the basis of goal, what goal you are taking, on the basis of that you are going to evaluate it. Okay, so this is the last phase. So how do you do? These are the steps. Identify the evaluation criteria, on basis of what you will be measuring that particular intervention. Collect data to compare actual outcome with the expected outcome. Interpreting and summarizing the finding. Documentation of the findings. Continue, terminate, or revise the nursing care plan. That's what I was saying, that after evaluation, what is there? It is not that you will give up there. Okay, you the patient is having some problem, you are giving some care, and then it is not improving. To some extent it is improving. What you have to do, that is replanning. Okay, that is the last phase of evaluation. You have to replan, you have to replan it. Okay, clear about little bit nursing diagnosis, planning, implementation? Just give me a feedback. Are you able to follow something?
Yes,
Yes,
ma'am.
ma'am. Yes, you are clear?
Yes, ma'am.
The three types of nursing diagnosis you are clear about now? See you, bye. Thank you.